Hey everyone, welcome to the fourth episode of Mind Shots. This is Alan here. Now, one of the fears behind taking psychiatric treatment is a fear towards taking psychiatric medications. And now, some of us have doubts regarding it. There are some myths and misconceptions surrounding the medicine that falls under this category, such as who can prescribe psychiatric medication, what should a person know while talking to the psychiatrist, what is the role of family support when it comes to effective response to these medications. And to explore these concerns today, we have with us Dr. Ravindra Munoli, MD Psychiatry. Dr. Ravindra works as an Associate Professor and Consultant Psychiatrist at Kasturba Medical College, Manipal. Welcome to the episode, sir.
Thank you, Arjun.
So the first question that we have is, what are the important mental health issues where psychiatric medications are the first line of treatment? Or, the general kind of mental health issues that psychiatrists prescribe medication for?
Okay, so let's come to the basic point before we move ahead to the question.
Yeah.
We need to understand that the psychiatric disorders have biological basis. In the sense, there is some alterations in the brain chemicals. So that is the reason with what we see manifestations. Let us name them as either schizophrenia or depression or bipolar disorder or dementia or anxiety disorder, so on and so forth. So when we have some biological basis for that, so we may have to consider biological treatment for the same. No doubt that only that much may not suffice in certain conditions. We may have to go ahead with additional or augment the treatment with psychological and psychosocial interventions. So, ideal holistic approach is when we go ahead with biological treatment, that is the medication, then psychological and social intervention. Now, the question proper you mentioned about what sort of disorders will require treatment. Most of the disorders require medication. However, when we feel the symptoms are very mild, so which can be managed with counseling or what we call a psychotherapy, to be scientific specifically. So, in mild conditions, for example, I have mild anxiety. I have some symptoms of depression, but not syndromal depression, or very mild variant of depression. There is some scientific evidence, with the counseling and psychotherapist, we may be able to manage. Or otherwise, so for most of the disorders, as I mentioned earlier, example dementia, what we call is forgetfulness as we age because of the loss of neurons or neurotransmitters in the brain, or schizophrenia, or depression, or OCD. So in these conditions, the primary treatment will be pharmacology plus psychological and psychosocial intervention based on the patient's needs. So let us be clear on this. Otherwise, the concept will get diluted where the people will believe, so only few conditions will require psychiatric medication, or won't require. Because the ideal holistic approach or holistic understanding of any psychiatric disorder is biopsychosocial perspective. In the sense, biological basis, psychological basis, and social basis. So when we understand the illness from these 3 points, we will be able to understand it better. Also, our evaluation and our intervention will also be along these lines. Not only just medication, not only just psychological intervention, not only just social intervention, but all 3 interventions together.
How does a psychiatrist decide what medication should be prescribed? There are different people with the same illness, but they also have different medications. Why is that happening?
Yeah, it's quite an important and very nice thing to know. Because the medication that is determined depends on various factors. First, person's age, person's comorbidities. In the sense, whether person has any other medical disorder. Whether person is in the reproductive age group, or person is a pregnant lady, or a person is lactating woman, or person is a child, or person is a geriatric or old age person. So based on this, medication will be decided. The second thing is a person is adult, doesn't have any other problem as such, then despite that, the same medicine will not be prescribed to all the patients, because the manifestation of disorder is not same in all the patients. For example, when I tell a patient is suffering from depression, so all the depressions will not have same symptoms. We need core symptoms like person needs to be sad all the time for last 2 weeks. Person should not be able to experience any pleasure in pleasurable activities. Person should feel tired all the time. Person should have sleep problem. Person should have appetite problem. However, not all patients will manifest all the symptoms. Okay, some patients will manifest few features, some patients will manifest all the features. So, depending on the symptom profile, in the sense, depending on the presentation and clinical features, we'll decide what medication will be appropriate for that person to address the main symptom. Okay, though the medicine may be of same group or of a different group, but it will depend on the patient's other medical illness and the symptom profile. Also, at times there are many other factors which will determine. Example, a person, father, just taking an example, who was also suffered from depression or say bipolar disorder, had responded to a particular medicine. Okay, when the son has manifested the similar illness, there are high chances that the son will also respond to the same medication to which father has responded because of the similar genetic makeup. So like this, so various factors will come into play which will determine the choice of medication for the same illness. So that's why you will end up seeing, okay, one person has received this medication, whereas for similar diagnosis may be similar. Okay, I have diagnosed depression for one person but different medication. Another person also with depression but different medication. At times another person with depression has two medications. Okay, so all this will depend on these certain few factors which I have mentioned.
All right. So, with us mental health professionals, we always assist our patients, to follow a certain treatment plan that we have decided. And we also want ask them that if at all they feel like stopping the medication, it should not be all of a sudden, and they should inform the psychiatrist. So, what are the common reasons that these clients come up to you for saying that they want to stop medications, and why do we ask them that should always be done only after having a discussion with the psychiatrist?
Yeah. First of all, the medication duration is different for different disorders, and also how many times the person had any illness. For example, a person who is suffering from depression, I may start medication now. I may not see full change, or the patient may not appreciate change in the symptomatology or the depression for at least 2 weeks. Okay. So after 2 weeks, okay, the person will tell, okay, doctor, I'm taking medicine, but I'm still not better. Just like I take a pill of fever, immediately I feel all right in half an hour. Whereas that's not happening in depression. So this is mainly because the chemicals which got altered in the brain, the whole mechanism which is there, it needs to be retuned. That may take 2 weeks at least. Okay, subsequently to get back that system to the normal level like what it was before the onset of illness, it may take 9 months to 12 months. Okay, so that's why we ask the patient, for just in case of depression, for the first time, if a person is having depression, to continue medicine as we suggest for at least 9 to 12 months. Okay, subsequently what we do is we'll try to reduce the dose gradually, and then also we'll monitor whether the symptoms or the illness is re-emerging or reappearing again. Then we'll stop the medicine. So our emphasis on the fact that why they have to adhere to treatment and why they have to consult a doctor before stopping or reducing is because of this. Another point is, the patient stops medicine abruptly, the illness appears again. The problem that happens the second time is the same medicine may not suffice, or the same dose may not suffice. Okay, the person has responded, just say example, the person had responded to or improved with 10 milligram of a particular tablet in the past. However, he stopped medicines, then symptoms appeared again. He may or may not do well with 10 milligram. I may have to go up with 20 milligram because the illness which has come back again may be of more severe variety or may not respond. In that case, I may have to change medications or I may have to add one more thing.
Yes.
So the whole goal for us is to keep the person symptom free or illness free, because the more the person spends time in illness, the more will be disability. his working days will be lost or his study days will be lost. There will be economical, financial, and various other things will come up.
Yeah.
So to prevent all these, evidence says for certain disorders, for certain duration of time, certain medications have to be continued. And there are guidelines when we can reduce or when we can stop or when we can continue for longer years. So that's why it is always necessary and important to consult the treating psychiatrist whenever the person feels he or she wants to reduce the dose or wants to stop.
All right. Yeah. That also makes the connection with you mentioned that they will lose days on working or if it's their studying as well. So also with the whole financial cost of it, be hospitalized again. Also, when you mention again with the duration and of stopping the medication, the immediate question we always get is, will I have to take medications for the rest of my life? What do you have to say about that?
Yeah, that's one query that we come up with every time when we are starting any treatment. The first thing that tells us, do I have to take this treatment or this medicine lifelong?
Yeah.
Okay, so that question is very valid because if you frankly ask me, I don't like taking medicine lifelong, or no one else will like taking medicine lifelong.
Yeah.
Okay, so that too, when we tell, okay, this is a psychiatric disorder, they will ask like, okay, where is the lab report? Okay, you show me some investigation report. Okay, which is difficult at the time. So that's the myth at times, like when they feel like, okay, I should take all the medicines all the time. Okay, as I mentioned earlier, there are guidelines based on the scientific evidence how long a person should continue any medicine for any disorder. Okay, it's not fixed like I should give only this medicine for lifelong for this disorder. No, as I mentioned earlier, there are guidelines for depression, how long you can give a medicine depending on the response. Okay, it may be for 9 months or 12 months for the first time when the person has depression. Okay, after symptoms resolve or the person remits, and in addition there will be other psychological and social interventions which will keep the person symptom free in the future. Okay, and in patients in schizophrenia or in bipolar disorder, when they respond very well, then we have to continue medicine for certain number of years or at times many years. This is mainly because, as I mentioned earlier, we want to keep the person symptom free.
Symptom free, yes.
Okay, example, you take it in bipolar disorder where the person will have depression and manic episodes. Each time the person is in episode, roughly 3 to 6 months are gone. The person is suffering, he is symptomatic and he is either in hospital, is not working, loses job, not able to study, misses all opportunities. So when he comes back again after treatment, again he discontinues medicines after a couple of months, again he comes back in an episode. So the best possible way is to prevent these episodes. Otherwise the person will remain in episodes, the person, physical health, mental health, everything will get destroyed. So for that reason, for these disorders, chronic disorders, which will keep recurring, like bipolar disorder, where episodes of depression may happen, or schizophrenia, where there are chances that the episodes will be there or the person's illness will continue. When we stop medication, it may recur. So in conditions like this, we suggest to continue medicine for a longer year. As the person gets stabilized, we may consider taking, if there are 2-3 tablets, we may consider stopping 1 or 2 medicines, or we may keep only on 1 medicine at the lowest possible dose or at the most effective dose. So we can just compare it with something like there is a hypothyroidism where thyroid hormone level is low in the body. So the person has to morning, he has to get up and take a thyroid pill. That is just to keep the thyroid hormone level in balance so that all body functions okay. In same manner, the people should consider, just like the physical health of hypothyroidism, the mental health or the illness which is there, like bipolar or schizophrenia or the depression which keeps occurring again and again. To keep them in check or to keep the balance of mental health, they may have to continue medicines for the longer years.
Exactly, yeah.
Okay, so also similarly like in diabetes or in hypertension. So until unless we give the same significance like our physical illness, this question will keep recurring, and every mental health professional who goes for a service will keep facing this question again and again.
Yes. When a patient or a client comes to you or goes to a psychiatrist, what are the questions that they should feel free to ask their psychiatrist, and what is the kind of information that they should share in confidence with the psychiatrist?
That's very important. First and foremost thing is the choice of medicines, as I mentioned, will depend on person's profile. In the sense, person's family history, somebody suffering from illness, somebody has responded very good to a particular medicine, or someone has any other comorbidities. No need to hide when you go to a psychiatrist. Okay, you can tell I have a family history of diabetes, or I had raised sugar, or I had obesity, or I have hypertension. All these things need to be communicated to the treating psychiatrist, because the choice of medicine will depend on these things. Example, if I have a patient whose father and mother both have diabetes, I will choose a medicine which will not increase the person's hunger, or which will not alter person's blood sugar in future. So I'll be very cautious while starting the medicine only. If I hide that history, the person may be more hungry once they take medicine, he may eat more. In the longer run, probably after 5 years or 10 years, he may have symptoms of diabetes. All these things have to be communicated to the treating psychiatrist as and when is required. And what person should ask? After communicating everything, discuss with your treating psychiatrist about each medicine. So each medicine, what is it is for, what is the dose, what adverse effects I can anticipate. It's not that nothing is out of the ambit of adverse effects. You take a simple B complex also, many patients have fainted with B complex. The body responds differently to different drugs, but ask for commonly occurring adverse effects of medication. Doctor will be able to tell you how what you can anticipate and how you can handle those adverse effects if at all they are occurring. Right? And also the patient should ask, when should I report to you in case I feel like something is not okay or going wrong? That's also important. At times the adverse effects may be severe, so then immediately where should I approach, what should I approach? Also, the psychiatrist will tell you, observe for these many days. If the symptoms are worsening, immediately come and consult. Right? So these things have to be discussed openly while the medicines are prescribed.
Thank you. With a follow-up to that, at times clients or patients go to the wrong mental health professional asking them for a prescription for their medicine. So can we make it clear, who can a patient get a prescription for their medication from?
It's a very important thing, because there are legal aspects also for this. For example, Medical Council of India has ethics and the regulations in 2002. There you keep it revising. It clearly mentioned that a person should restrict himself to his or her own specialty. So for example, being a mental health professional, though I am trained in dealing with medical illness also, so it doesn't mean that I should start treating for diabetes, right? Or I should start treating cardiac disorders, or I should start treating endocrine disorders. No, that will become unethical and illegal also. So it always becomes a responsibility of the person and also the treating patient to restrict themselves to the profession that they are, or the specialty in which they are trained in. So what patients can do is identify the proper mental health professional. So the mental health professional has a definition, and also the area of expertise and the limitations in which and what they can do. For prescribing medication, it is a psychiatrist. The qualification is either diploma in psychiatry or MD in psychiatry, recognized by Medical Council of India, and DNB, Diplomat of National Board, which is also now recognized by Medical Council of India as part of government. So these are the degrees which are obtained after completing MBBS, and these are additional training, additional courses. These are the people who are qualified in prescribing psychotropic rationally and addressing these psychiatric disorders. Many times it will happen that somebody will claim also so and so doctor, but there won't be any qualification below it. So they will end up prescribing some random medication. So kindly check person's qualification and registration number. So you can go to the Medical Council of India website and find the person's name, because Indian Medical Register is there. It is openly available to all the citizens. Medical Council of India, go to the website. Information desk, click on that. Then you go to Indian Medical Register, click on that. There is a search option. The particular doctor's name, you type it there. Then you click on that, the doctor's details will be available. Doctor, his qualification and degree. If you haven't done it, you can confirm it anytime. Also, if you are finding the doctor's details on a website or in a hospital, usually all the hospital will mention the person's qualification and the specialty clearly. Or if you are consulting online, it is a responsibility of the website which is hosting to mention the doctor's profession, qualification and registration number.
Okay. Yeah.
So please verify this before you go, because earlier the intervene it is always better. But earlier the intervene with the wrong person, which may lead to some more complication if not treated rationally.
Yeah.
Okay, so we have to keep that thing in mind.
Yes.
Yes.
Thank you for sharing that very crucial information, sir. I mean, because when they finally reach to the OPD or to the psychiatrist, we get to see that they've had a long route of meeting the wrong people in between, and then finally coming to the hospital. And then going to the next question that we have, when we discuss with this patient about making sure that they have their medication, is it just the responsibility of the patient, or is there a role of the family or their friend when it comes to having good response to the treatment?
Yeah, so unlike other illness like in diabetes, hypertension or other things, so the psychiatric illness are what we call is family illness. In the sense it's going to affect all members of the family in one or the other way. Just imagine a person who is diagnosed with schizophrenia and not responding, and he's having hallucinations or he's violent. Okay. The whole family atmosphere will get disrupted. That's first thing. Second thing is like some person has to be there round the clock to monitor that person. Third thing, the person he's not working, he's not earning, that will act an additional responsibility for the family to take care or the compensate for that person. So it's like every illness is going to affect a person's family. So it's not just the responsibility of the patient, it's the responsibility of all the people in the family and in the surrounding.
Yeah.
Because the illness characteristics themselves may make the person to drop off from the treatment. Example, if I can give an example of schizophrenia, person will not have insight. In the sense, person, whatever he is hearing voices when he is alone or whenever he is suspecting people, he feels that whatever he is perceiving or whatever his thoughts are, they are true. So in the reality, they are not true.
Yeah.
So when you take him to a psychiatrist, first of all, he will tell, okay, whatever I am having is normal, it's not abnormal. He refuses treatment. Okay, if I give the responsibility of taking medicine to the patient, he may take when in front of me, after that he may not take. So again the symptom will worsen. So it is always better and a must thing to involve family in the treatment, to ensure adherence so that person will continue taking medicine, to ensure support. If the family member is aware that okay, the person, whatever he is doing or behaving are because of illness and not his own normal behavior, they will be able to understand and appreciate and make some adjustment. Also, if they know the limitations of the person because of his illness, they will be able to make some adjustment in home atmosphere or at workplace, or give him some little extra time or modify the work pattern as per the patient's need to make or keep him comfortable. So many such things will come. So it's always better to involve family members. At times the person may become suicidal in depression or other illness. If patient comes alone for follow-up and tells doctor, I have planned to die, so I am going to commit suicide tomorrow, not today. If I have not involved the patient's family member right from the beginning, or I don't have the contact number of them, the person just goes off then.
Yeah.
So there are untoward circumstances. So it's always essential if we have family members as part of the treatment.
Yes. All right, sir. Okay, and moving to the last few questions that we have.
Yes.
What else should our client or the family as well keep in check for better response to the treatment?
Yeah, the first thing is they need to ensure adherence to treatment, in the sense of whatever instructions are given. Not only about medication, obviously they have to ensure medication. Apart from medication, many other things are being told to the patient and the family members to be followed at home. As I mentioned earlier, making adjustments in the person's home atmosphere or work atmosphere or study atmosphere, so those have to be strictly observed. And all the concerned people have to be kept informed. For example, a person has some disorder, anxiety disorder. Okay, if I give him a job which will involve interaction with many people, the person may drop out from job. There are high chances. Whereas some tweaking or some adjustment has been made for time being and give him a desk job which may not involve interaction with a lot of people. That files will come, he has to work and go back. So I'm just giving an example. So like that, some adjustments have to be made in the beginning. So once the person starts coming out of illness, we may make modification at either study or at workplace. So family members have to adhere to these things clearly. And also the family members will be told about the warning signs, in the sense when the illness worsens or the person deteriorates or when there is high risk of something happening, those signs and symptoms are conveyed to the family member. So immediately they are supposed to either get the patient to the treating psychiatrist or inform to the nearest mental health professional. This is for the safety of the patient and for the people around the patient.
Yeah, very important. Some of these patients or even family members will also be in having a habit or maybe consuming substances as a lifestyle. So does that affect the response to the treatment? What do you have to say about that?
Yeah, definitely. So if you name a few substances commonly used are alcohol and tobacco, then we see the patients with very psychiatric disorders consuming those. The problem that happens is these substances, let it be alcohol, cannabis or etc. They themselves can lead to various psychiatric problems. Firstly. Second association is on a pre-existing disorder. When the person starts consuming these, whatever the disorder is there, that will worsen. Right. We have alcohol-induced depression, we have alcohol-induced psychosis, we have cannabis-induced psychosis, we have cocaine-induced problems. So they themselves can cause illness or they can worsen the existing illness or certain drugs can enhance the elimination of a medication. In the sense, for example, smoking. A person is taking medicines for schizophrenia or bipolar. What it does is it will increase the metabolism of those medications. In the sense, they get metabolized faster and move out of body faster. A particular 10 milligram tablet, which was effective, may not be effective when the person starts smoking 10 or 20 cigarettes per day because it is getting excreted from the body rapidly. It's not staying in the blood or it's not at the optimal level in the brain at which it acts. So these are important issues. So always we have to dissuade or address the issue of substance use in all patients. Let it be alcohol, cannabis. Another important thing is when the person is at risk of self-harm or risk of harm to others, the judgment gets impaired when they are under the influence. When the person is consuming alcohol, the judgment gets impaired. He may either end up harming himself or harming someone else. Right? So they have to be dissuaded or that must be addressed in all patients.
Alright, sir. And another follow-up before we move to the last question. Some of these clients have also come saying that will the medication push me to dependence? Will I be dependent on the medication forever? Like, will I get addicted to the medicine? Is that something that happens with these medications?
No, the question we can frame it something like that. Where the person is doing well because of the medication, right? Because so that means it is keeping the chemicals in the brain in balance. Okay, the person is doing well. Because the chemical system is not staying in balance naturally, we may have to give something to keep it under check.
Yeah.
For diabetes, I'm giving medicines because to keep the sugars under control. I'm giving a medicine for hypertension to increase blood pressure to keep the blood pressure under check.
Okay.
Does it mean the person is dependent on medications of diabetes or does it mean the person is dependent on medication of hypertension? No, because the things are, they are keeping the things under control. Just like that, the symptoms or the manifestations of psychiatric illness, they have to be kept under check or under control. For that, we are giving medicines. The moment I take a medicine from diabetes, sugar will shoot up. It will lead to complications, what we call as end organ damage like kidney damage, eyes damage. The moment I take up the medication from hypertensive patient, the blood pressure will go up, the person will have a stroke or the person will have a cardiac complication. In similar way, the moment I take up the medications in certain patients when it has not reached a normal level, the person's symptoms may re-emerge. Like what we may see in bipolar disorder, we will stop a mood stabilizer tablet. Slowly after a couple of months or a year or immediately, the person may come up with one of the symptoms of the episode, either mania or depression or schizophrenia may worsen. So rather terming it as a dependence, we can tell that it is because of the medication things are under control. Dependence, what we call as for some other substances, okay, for alcohol or other things, where the person will have craving for them. Okay, they have to take it, otherwise they will like. As the time passes, the small amount will not suffice, they want more of it. For example, alcohol, they will start with some beer or something. They move to whiskey from 30 ml, 90 ml or 180 ml, it goes up and up.
Yes.
They gradually start ignoring other pleasures in life. They will just hook on to that particular substance. Okay. So those are the things which we can think of them as dependence. Probably we may have to explain it to the patient clearly. Dependence is something which we use, or one thing we use the term for these things. Medications are there to keep things under control, just like the medications of diabetes, hypertension, or hypothyroidism.
I think we can move on to our last question. With your years of experience, along with the medication helping the response to a good treatment, what is the role of the other mental health professionals who work with you?
Yeah, I mentioned initially, so the illness has biological, psychological, and social perspective. Only one line of treatment will not suffice. The ideal holistic approach is biopsychosocial approach. Okay, I can give some medicine. Okay, for example, a lady has a depression. In addition, has a problem in the family. Right? Okay, she has interpersonal problem, in the sense the problem is between relationship in one-to-one relationship, either with the husband or with the son or with the other family members. Okay, so that medication won't address that, right? Medication will help in reducing symptoms of depression.
True.
So how are you going to address that? So for that, we need psychological and psychosocial intervention.
Yes.
Okay, just give an example. So the ideal approach is biopsychosocial approach. Okay, so we have to do medicine, we have to do psychological assessment to assess what interventions we need. We have to do psychosocial evaluation and intervention.
Yes.
So I recommend, or I have good results with biopsychosocial approaches. So I feel that's the ideal way which is being practiced in almost all the places. So we can't segregate that I will just give medicines and you will be all right. No, that's not the way. Okay, so all three have their own roles. All three are important. All three must be there together: biological, psychological, and social.
Okay.
Yes.
Okay, sir. Thank you. Thank you so much, sir, for joining us today and helping us answer these questions. We can wind up today's episode.
Yes. Yeah. Thank you. Thank you, Alan. Thank you for this wonderful interaction. I look forward to be part of it again. Thanks a lot.
Thank you guys for listening. Hope this has given you some clarity regarding medicine and psychiatry and helps you in communicating well and asking better questions to your mental health physicians while deciding on a treatment plan. Comment if you have more questions regarding psychiatric medicine and we'll try getting your questions answered. Also, Mind Decoded has a Facebook page right now. All you have to do is search for Mind Decoded and find us there, and don't forget to like us. See you soon, be resilient and keep safe.